Hello, my name is George Lavender. I'm your Ross County Sheriff, and today we're meeting after an operation that's come together, a bridge operation where Richard Meadows from the Ohio Department of Public Safety comes in and coordinates the efforts of all the community resources to come together on fighting the drug addiction in Ross County. And we're always happy when he comes in and gets us established because we all make our individual efforts. We have port team that goes out and meets people that's overdosed. We have enforcement that's always looking to, arrest on drug charges and stuff like this, but we have to have that recovery element too. And that's what Richard does. He does a great job of coming in, coordinating all this effort. And there's been 2 days of just making contact after contact with the recovery services. We still, as law enforcement, want to go out here and bust the main players on drug addiction. The people that's supplying the poison on our streets, we want them out of here. But then again, if you take the drugs out of here, you got to have the recovery efforts. And when you look at everybody gathered here today, that effort's been intense, and we always appreciate him coming in to do this. So,
this is your second year participating in Bridge.
Yes.
How do you see it making a difference in your?
Well, I was talking to Mr. Meadows earlier, and we were in an area where a guy had overdosed, and ultimately they got there and administered Narcan. This is what this is about: saving lives. People get caught up in addiction. Some people, it's through medical procedures they have or being put on, hard drugs to help injuries at work and that kind of stuff. Some people don't, start out to be addicted. Some people comes from addicted families, so it follows them, in their lifetime. Whatever the thing, we never want to see anybody in our community die from drug addiction. We have programs such as DARE in our schools. We do that at an early age to, introduce kids about drugs and to keep them off drugs. We have the MAID program to let kids be drug free and be tested for that. So we're trying the thing about education, but we're also the ones that's already locked into the drugs. They need help. And I'm a witness. My son was involved in this, and he almost overdosed and died. And I'm a strong proponent that we need those recovery. He went to recovery. He's doing great now. It's what's going to help us. It's what's going to help us, fight this battle that's taken over our streets.
Hi, my name is Ron Myers. I'm the Chief of Police for the City of Chillicothe. We're happy to participate in the bridge detail brought to us by the Department of Public Safety and the Sheriff's Office. It's good to collaborate with other entities, the State Patrol, Health Department, other mental health entities within our community. The main purpose of this is to reduce overdose deaths and overdoses throughout the community. It's important to get services to everyone out there. Has to kind of reiterate what the sheriff said. My belief has been, since I've started 27 years ago, education, enforcement, and treatment. So we need to educate the public on the dangers of drugs. We need to educate the public on the stigma of drugs. We need to enforce it. Whether we're not going to arrest our way out of this, believe it or not, but we still have to enforce laws, to decrease the chances of, drug dealers getting drugs into our community and increasing overdose deaths and overdoses. So we need to attack that portion of it. And then one of the more important things is treatment. If we don't get people into treatment, then there's the chance that they could, of course, overdose or die.
And that's what it's about, saving lives.
That is correct.
How important is it to get people back with their families and back in the community? Like how does, doing diversion instead of arrest, how does that help the community?
We always hate to see families torn apart. Kids are the ultimate victim out of all of this. So as long as we have a good safety plan with other entities, the courts, children's services, and things like that, then it's important to keep families together.
My name is Jason Gannon. I'm the commander of the U.S. 23 Major Crimes Task Force. A couple years ago, I was approached by Dick Meadows with the Department of Public Safety, reference a new program that was introduced into their office called Operation Bridge. This program bridges the gap in between law enforcement community and the outreach community. We had come up with a date, and this program has been put out throughout the state prior to coming here to Ross County and showed great success throughout the state. We had our first operation last year here in Ross County, and it was a huge success. We put several people into treatment. We run out of naloxone that we was distributing and ended up having to go get more naloxone. So this year we was a little more prepared for that. So Again, this year we had QRT teams that's out. We had 3 teams out this year in the city and the county, in Chillicothe and Ross County. Of those 3 teams, we made close to 200 contacts. We've got over 4 people connected with treatment here in Ross County. The community fair is going on behind me. The community fair with all of our outreach partners and treatment facilities. They've been doing a great job here as well. One of our teams that was out and about overheard a report of an overdose that had just occurred. That team responded. They was able to find this gentleman. He was given 8 doses of naloxone, and with that he was revived and went to the hospital, and he's back with his family now. Because we was out in that area at that time, that specific person needed our help, and we was there to save a life, which is pretty incredible. The other side of this is the interdiction side. We're out looking for the people that's bringing the drugs into the community. We're out looking for the people who are distributing these drugs. We've had several traffic stops. We've seized large amounts of cocaine, fentanyl, and methamphetamine over the last day and a half. And with that, we've seized a firearm. We're out targeting the people that's bringing the drugs into the community, and we want to offer support recovery services to the people that's suffering from drug abuse disorders.
That's really what it's about, right? It's I know a lot of people think that, you know, task force, all you want to do is arrest people, put them in jail, but there's a whole lot more to it than that in there.
There's a lot more to it. And with our task force over the last couple of years, we've got into the recovery side of it. We have agents assigned directly to our task force that works with the port team, that works with Project Dawn, the Hope Partnership. There was a story that I've heard, as not from our area, but it is a story where a known drug user from the area that the police have dealt with constantly. Another QRT team has contacted this person, got him into treatment. He went through treatment. He is now a firefighter, and he has gone through paramedic school. So the services that are being offered, these services go beyond just what we're doing here. They change people's lives, and that's what we're out here to do.
I'm Janelle McManus, the Health Commissioner for the Ross County Health District. The past 2 days have provided a glimpse into the daily collaboration between organizations within Ross County. I wanted to highlight how the Health District is responding to substance use disorders beyond this event. We have school education, in which we're facilitating an anti-vaping curriculum in Ross County schools. This is an evidence-based program that provides education to students to reduce likelihood to vape. A total of 442 students have completed this curriculum. Project Dawn is the distribution of naloxone. We have 11 lay distributors, 19 secondary distribution sites. We supply naloxone to 6 harm-reducing vending machines throughout Ross County. We have a mail-order naloxone program, and we supply naloxone to 8 nalox boxes. A total of 1,793 naloxone kits were distributed, and 365 reported lives were saved with naloxone in 2023. For the post-overdose response team, it's a collaboration with multiple agencies: the Ross County Health District, the Chillicothe Police Department, the Ross County Sheriff's Office, the Chillicothe Fire Department, the Ohio State Highway Patrol, Ross County Community Action, Hope Partnership Project, and First Capital Cornerstone of Change. They have 2 teams, one within the county and one within the city, that conduct in-person visits, phone calls, text messages, and social media messaging to connect individuals that have recently overdosed to resources. They've made 121 successful contacts for 2023. We saw a 32% decrease in reported non-fatal overdoses compared to 2022. Our overdose fatality review is a collaboration with multiple agencies to identify trends so that strategies can be developed to reduce overdose fatalities. We saw a 17% reduction in overdose deaths from 2022 to 2023. Because of our strong partnerships, we're making a difference in Ross County, seeing improvements, changing lives one day at a time.
I'd like to thank the Ross County Sheriff's Office, the Chillicothe Police Department, the Health Commissioner and her staff, Jason Gannon, Task Force Commander, Living Merriman and the port team for all the great work that they do down here. Without those folks involved, we couldn't have the success that we have down here. You know, with the support that we get at the state, local, and federal level, our partners at Recovery Ohio, you know, we need every one of these folks to make this a successful event. You know, the Highway Patrol, the Sheriff's Office, and the Police Department are out working interdiction. They're focused on the supply side of the drugs, and these folks here are working on the demand side. And you know, this is what we need, is this type of interagency cooperation and everybody working together. They're doing great work here every day. These 2 days just brings the attention that they deserve. They're, you know, what I've been noticing across the state about the outreach partners, they're not really good about patting themselves on the back. And this is a great way for us to bring the attention to what the great work they do every day.
Talk to me again about the life saved, the story that Jason.
You know, yesterday there was an individual that was given 8 doses of naloxone, and because of this detail, the folks were in a position, they were close, and I was told yesterday that if it hadn't been for this, they wouldn't have been in that. And this particular person was at work, and there wasn't naloxone available, and they were able to go and save that life, and then they actually left naloxone back, so if something like this would happen again, that they would be prepared.